For seniors over 60, heart failure is one of the most dangerous and life-threatening conditions. Yet many older adults unknowingly repeat daily habits that quietly damage their heart without any warning signs at first. As a heart doctor with over 25 years of experience treating patients in their 60s, 70s, and 80s, I am truly shocked to see how 5 common habits, which seem normal on the surface, are silently triggering heart failure, congestive heart failure, high blood pressure, and dangerous heart attack symptoms. These habits slowly harm heart health by weakening the heart muscle, increasing pressure in the arteries, reducing oxygen supply, and disrupting the delicate balance of circulation metabolism and insulin function. What makes them especially dangerous is how unnoticed they go, becoming part of a routine that feels harmless but leads to long-term damage and eventually serious cardiovascular complications. Many seniors don't feel any symptoms until it's too late, when fatigue, dizziness, confusion, or even a sudden collapse signals a serious problem. If you are a senior over 60 or you care for one, today's video is one of the most important health tips you will ever receive. Welcome to Wellness Daily 395, the channel dedicated to helping older adults live longer, stronger, and more independent lives. Our mission is clear. We aim to help seniors over 60 prevent heart failure, reduce risk of high blood pressure, understand heart attack symptoms, and improve quality of life with small but powerful lifestyle changes. Every week, we bring research-backed strategies, real-life examples, and simple solutions you can apply immediately to protect your heart and your overall health. My name is Dr. Anthony, a board-certified cardiologist, passionate about senior wellness and heart health education. I've seen how small shifts in daily routines can either prevent or trigger major cardiac events, and I believe no senior should suffer from preventable heart failure when the right knowledge and support can make all the difference. In this video, I will walk you through 5 specific habits that you must identify and eliminate before they cause irreversible damage. These are not dramatic or extreme behaviors. They are often overlooked. Details like a drink. You always reach for a sleep pattern. You ignore or a morning ritual you've done for decades. But science now tells us that even one of these habits can slowly push the heart into dysfunction. Heart failure does not happen overnight. It builds over months or years, and for many seniors, by the time they notice something is wrong, their heart function has already declined. That's why today's episode is urgent. You deserve to know what's happening inside your body and how to reverse it before it's too late. So take a moment. Right now, hit the subscribe button to join our growing family here on Wellness Daily 365 and leave a comment below with your age and which heart symptom you're most concerned about. Whether it's high blood pressure, irregular heartbeat, shortness of breath, or fatigue. Your comment helps us shape future content around your needs and gives our team insight into what real seniors are facing right now. This is more than a video, it's a movement. You are not alone, and every step you take toward better heart health matters. As we begin our journey through these 5 ugly habits, I want you to pay close attention. Some of them might surprise you, some may feel uncomfortable to admit, but all of them are connected to real science and real consequences. In parts 2 and 3 of this video, we'll go deeper into the medical reasons these habits hurt your heart and how to fix them with practical steps, healthy recipes, hydration tips, and proven strategies that support heart attack prevention and heart supplements for seniors. But for now, let's begin by opening your eyes to the daily choices that may be putting your heart at risk without you even knowing. If you care about heart health, if you want to avoid heart failure and stay active, mobile, and strong in your golden years, then this video is for you. Don't just watch ACT. Your heart is listening. Now that we've introduced the hidden risks, Let's take a closer look at why these 5 habits are so harmful to heart health, especially for seniors over 60. The aging heart is not the same as a younger heart. With age, the heart muscle becomes stiffer, arteries lose flexibility, and blood vessels become narrower. This makes circulation more difficult, increases resistance, and places additional pressure on the heart. That's why high blood pressure is so common in seniors, and why high blood pressure treatment becomes increasingly complicated with age. When seniors maintain harmful habits, even small ones, they slowly damage this already fragile system, which increases the risk of heart failure and congestive heart failure. Let's examine the first habit. Many older adults skip hydration in the morning and go straight to coffee. While coffee isn't inherently dangerous, drinking it before water can cause dehydration, elevate cortisol levels, and tighten blood vessels. This puts more strain on the heart. Without proper hydration, the blood becomes thicker, circulation slows, and the heart must work harder to pump oxygen to the brain and body. The result is a dangerous loop of inflammation, fatigue, dizziness, and eventually increased risk of heart failure. The second habit is going to bed late, especially after 11 p.m. Seniors often think it's harmless to stay up watching TV or using a phone, but late-night hours disrupt the circadian rhythm. This affects blood pressure regulation and heart rate variability. Studies have shown that people who go to bed past midnight have a higher chance of developing heart attack symptoms and irregular heartbeat. When the body is deprived of deep rest, stress hormones remain elevated, and the heart does not get a chance to recover. Over time, this leads to heart dysfunction. The third habit is excessive salt intake. Many seniors still use table salt out of habit or consume processed foods high in sodium. Excess sodium causes fluid retention, raises blood pressure, and stiffens arteries. This is one of the most direct paths to developing high blood pressure and ultimately congestive heart failure. Reducing salt is a proven way to improve heart health, and yet it remains one of the most overlooked daily choices. The fourth habit is lack of movement. Seniors who sit for long periods, especially after meals, have slower metabolism, reduced insulin sensitivity, and poor circulation. Muscles don't contract enough to push blood through the veins, which increases clotting risk. It also raises the chances of developing high blood pressure and worsening existing heart conditions. Even light stretching or walking for 10 minutes after meals can dramatically reduce these risks. The final habit is mental stress without release. Many seniors carry emotional weight from loss, illness, or isolation, and they don't express or process these feelings. Chronic stress causes blood vessels to constrict, increases inflammation, and weakens the immune system. When left unresolved, it accelerates cardiovascular aging. Learning to manage stress, whether through breathing prayer journaling or community support, is one of the most effective forms of heart attack prevention. Let me give you an example. I once treated a 72-year-old man named Robert, who had no history of heart disease. He lived alone, rarely exercised, ate canned food daily, and often stayed up until 2 a.m. watching old shows. He believed he was healthy because he didn't feel pain. But one day, he collapsed while walking upstairs. When he arrived at the hospital, his blood pressure was dangerously high, his heart rhythm was irregular, and he was diagnosed with early-stage heart failure. With guided changes in his habits, like drinking water before coffee, using healthy recipes with fresh vegetables, and low sodium, walking 15 minutes each day, and adjusting his sleep time, he saw a dramatic improvement. His blood pressure normalized, and his symptoms of dizziness and fatigue disappeared. This case reminds us that early correction is always better than late treatment. Seniors over 60 must understand that daily routines are not fixed codes. They can be adjusted, or as we say in programming terms, they can be heart failure or heart attack into better versions. If we treat our health like a data system, our daily choices are like SQL commands. When you write good commands, the heart responds with better performance. When you ignore errors, the system crashes. The good news is, even after decades of bad habits, the body still responds positively to change. Scientific data supports this. According to studies published in cardiovascular journals, just 3 weeks of reduced sodium daily hydration and moderate activity can lower systolic blood pressure by up to 10 points. For someone already on high blood pressure treatment, that can mean fewer medications and a lower risk of drug side effects. Another study found that seniors who replaced just 2 processed meals per week with home-cooked healthy recipes had improved cholesterol-reduced inflammation markers and better sleep quality. That's the power of simple health tips. At Wellness Daily 365, we believe that you don't need extreme diets or expensive supplements. You need practical, proven advice that helps you recognize how daily patterns shape your heart. In Part 3, we'll reveal the step-by-step lifestyle solutions, morning strategies, hydration techniques, and nutrition changes that support heart health and prevent heart failure for seniors. But for now, I encourage you to write down the habit you want to change most. Is it your bedtime, your salt use, your hydration routine? By naming it, you begin the process of changing it. And remember, your heart is not failing you. It's waiting for you to care. For seniors over 60, protecting heart health does not require extreme changes. In fact, it starts with small daily steps that, when done consistently, can dramatically reduce the risk of heart failure, high blood pressure, and heart attack symptoms. Let's begin with the easiest and most powerful step: hydration. Drinking a full glass of water first thing in the morning helps thin the blood, improves oxygen circulation, and lowers pressure inside the arteries. This simple habit, done before coffee or food, reduces strain on the heart and supports metabolism. Seniors who begin their day with water often report feeling more alert, less dizzy, and more stable during their morning routine. Next comes nutrition. Seniors need healthy recipes that are easy to prepare, low in sodium, and rich in heart-protective nutrients. A great example is a bowl of oatmeal topped with berries, flax seeds, and a touch of cinnamon. This combination helps regulate blood sugar, reduce cholesterol, and improve blood vessel elasticity. Avoiding processed meats, salty snacks, and canned soups is key. These items raise blood pressure and contribute to congestive heart failure. Cooking at home allows you to chin-sua each meal according to your needs. It's like writing SQL code for your health. You decide the ingredients, the amount of salt, and the portion size. You don't copy bad habits, you heart failure. Smart choices that support long-term wellness. Sleep is another critical piece. Seniors who go to bed before 11 p.m. and avoid screens 1 hour before sleep tend to experience better heart rate control and reduced inflammation. Restorative sleep allows the heart to repair and recharge. It also supports insulin function, brain clarity, and immune strength. Even if you wake up at night, maintaining a consistent schedule helps your body build a rhythm that supports heart health naturally. Movement is essential. You don't need to run or lift weights. A 15-minute walk each day, light stretching after meals, or even standing during phone calls improves blood flow and supports heart function. Seniors with limited mobility can perform seated leg raises, arm circles, or gentle yoga. Movement stimulates the muscles and prevents the blood from pooling, which reduces the risk of clotting and improves circulation. Lastly, don't ignore emotional health. Stress, grief, and loneliness are all common in later years, and they directly impact your cardiovascular system. Deep breathing music, prayer, or even short phone calls with loved ones can lower cortisol levels and improve heart resilience. You must treat your emotions as part of your heart health routine. Healing is not just physical, it's mental, emotional, and spiritual. At Wellness Daily 365, we believe heart failure is not inevitable. With the right habits, even seniors who already have high blood pressure or early heart failure symptoms can improve their quality of life. Your routine is not fixed. You can update it, adjust it, and rewrite it, just like a SQL script that evolves with better logic. Every sip of water, every home-cooked meal, every walk around the block, and every early bedtime is a vote for your heart's future. You are not too old to change. You are just one decision away from better heart health. If you found this helpful, subscribe to Wellness Daily 365 and leave a comment with one habit you're ready to improve. Let us know what you'll copy into your life starting tomorrow. Together, we can fight heart failure, one heart, one habit, one day at a time.